You are commonly told that heart attacks are caused by cigarette smoking. So let us examine how cigarettes or nicotine or tobacco is harmful for the heart. Tobacco consumed in any form basically when it's smoked, either through cigarettes or in India what is called a local cigarette called as a BD, where the same tobacco is wrapped up in another leaf, not just the paper. So other forms is the tobacco leaf itself is formed into a cigar like thing and it is smoked. Whatever you may do, when you smoke, when you burn the tobacco dried leaf, it has the substances which in that are basically nicotine, which is the addictive part. So along with the nicotine comes other things like tar, and carbon monoxide. So people want the nicotine but don't want other things, which is so it is not possible in nature, isn't it? So along with the nicotine comes tar. This tar, see, when they smoke a cigarette, the smoke enters the lungs basically. From the lungs, it goes into the blood. So the nicotine goes into the blood, goes to the brain. That gives the high or kick of smoking a cigarette, or the feeling of well-being which comes with smoking a cigarette. But with that, the carbon monoxide and tar, the tar is commonly causes cancer. So through the lungs, when it is absorbed, the tar is deposited in the lungs, whereas the nicotine is absorbed in the blood. So the tar can damage the lungs and causes lung cancer basically. So other component is carbon monoxide. When the carbon monoxide absorbed from the lungs into the blood, when it goes through the blood to the brain, it damages the blood vessels of the body, all blood vessels of the body. It can cause constriction of blood vessels of the body and also cause increased clotting of blood in the blood basically. So increased clotting of blood, if it is on a long-term basis, what it can cause is the clots can obstruct the blood vessels. If there are large clots, depending on the size of the blood vessel, basically, if the blood clot forms in the heart, it is called as a heart attack. If it causes the blood clot occurs in the brain, it is called a paralytic attack. But commonly in young people, these blood clots can occur in the heart and can cause a heart attack. So carbon monoxide is the prime inciting agent of the cigarette smoke, especially for young people. It also causes constriction of the blood vessel. So blood vessel size has come down and also there is a clot inside the blood vessel. Typical case to cause a heart attack. So this is the in young people especially the commonest cause of heart attacks in young males. I have seen a patient who had a major heart attack when he is 18 because of cigarette smoking. So cigarette smoking is the cause for heart attacks in young males basically. See, there can be 10 people who smoke cigarettes. All people may not have a heart attacks depending on the genetic predisposition. So the harm occurs. For some people, genetically they can have a heart attack. For some people, they can have a cancers all over the body, not just the lungs, it is known. So coming back, because I'm a cardiologist, what I want to tell you is cigarette smoking can cause heart attacks by constriction of blood vessels and increased blood clots. So please stay away from cigarettes so that risk of heart attacks comes down, and watch, especially if you have a family history of heart attacks, you are doubly at risk, and if you have a high blood sugar, diabetes, strong family history, actually double your risk with a cigarette basically. So smokers, please stop it as quickly as possible. Thank you.